In our daily walking habits, we will have a certain exercise called the gait cycle that helps us walk without using excessive effort in muscle movements. My name is Brian Wong. I'm presenting to you the gait cycle. When we walk, each muscles and joints works cooperatively with momentum and gravity. This refers to the gait cycle. In this video, I will explain the gait cycles and types of muscles actions in hips, knees, and ankles, along with the range of motion needed for each actions, and we will be able to discuss a few classical gait disorders and how does it compare with a normal gait pattern. A gait cycle consists of 60% in stance phase and 40% in swing phase. The stance phase begins with heel strike, also known as initial contact. The hip flexor muscles eccentrically contract to control the lowering to 20 degrees of hip flexions as heel contacts. Knee flexors eccentrically control extension assisted by momentum, while the ankle dorsiflexors eccentrically control plantar flexions as the lower forefoot contact the ground. In loading response, hip extensors concentrically contract to continue decelerations as momentum helps flex the hip to the midline, while the knee slightly flexed as a result of accepting weight assisted by concentric contractions of quadriceps. The ankle goes to neutral position to prevent foot rub decelerating mass as the ankle plantar flexors eccentrically control dorsiflexion. While in mid-stance, hip extensors concentrically contract for hip extension during single lip support, while the knee extensors continue contract concentrically to stabilize knee, and the ankle plantar flexors eccentrically control dorsiflexions to preserve momentum. In terminal stance, the hip flexors contract eccentrically to decelerate thigh and prepare for swing in 30 degrees of extension. Full knee extensions by momentum controlled by eccentric contractions of knee flexors, while the ankle plantar flexors accelerate mass by concentric contracting. This is to advance over the supporting foot. In pre-swing, hip flexors decelerate the thigh by concentric contractions, initiate hip flexions during heel off, while the knee flexors approximately 30 degrees flexion to clear the ground controlled by eccentric contractions of knee extensors. Reaching into swing phase, hip flexors concentrically contract to accelerate the thigh with 15 to 20 degrees into neutral. The knee extensors control the flexion driven by passive mechanism from hip joints to a slight 30 to 60 degrees, eccentrically controlled by the knee extensors after toe off. The ankle decreased from 20 degrees of plantar flexion to about 5 degrees of ankle dorsiflexions. The ankle dorsiflexors concentrically contract to dorsiflex the ankle into neutral. This is to clear the foot off the ground. In mid-swing, hip extensors control flexion from adjacent to 20 degrees as the hip is driven by momentum. Knee flexors concentrically flex 30 degrees to clear the foot and ready for heel strike. The ankle dorsiflexors begin in approximate 5 degrees of plantar flexions to neutral. Dorsiflexions was maintained by isometric contractions of dorsiflexors. It positions the foot. Finally, in terminal swings, momentum is driven in 30 degrees of hip flexions, which is eccentrically controlled by hip extensors. Knee flexors eccentrically contract to decelerate the leg during forward movements, and the extensors contract concentrically to full extend the knee to desired stride length and to position foot for heel strike at initial heel contact. Dorsiflexors still maintaining dorsiflexions by isometric contractions, which will remain neutral until the point of initial contact, that is the beginning of a new cycle. Range of motion decides the ability of a person to walk normally. In gait cycles, the ankle should be able to dorsiflex for 10 degrees and plantar flexions for 20 degrees. For the knee, would be in full extension 0 degree and the flexions to 60 degree, while the hip should be able to do 30 degrees of flexions and 20 degrees of extension. Other structures of the lower limb also contribute to the stability of a gait cycle. Hip abductors such as gluteus medius and minimus and tangent fascia lata Stabilize the pelvis isometrically all the time to maintain ipsilateral level of the hip while partial weight bearing. Intrinsic muscles and tendons of the foot, such as tibialis anterior, posterior, flexor muscles, we're also contributing to preserve longitudinal arch all the time. Disruption of gait cycle will result in abnormal walking. These are some classical examples that were used often in clinics to analyze possible weakness or injury of certain patients or clients. Gluteal muscles are important to maintain ipsilateral level of the hip during walking. If those parts are impaired, the patients may show signs of Trendelenburg gait, as this will become an abnormal gait that the glute medius muscles are not able to control the hip. The ipsilateral level will not be maintained and the patient would not able to control the hip from moving to the side. Antalgic gait is one of the common forms in patients who have an emergency conditions and they have a pain in one of the limbs. The abnormality came from the patients avoiding using a certain part and therefore resulting a shortened stance, and the stance phase will be shortened relative to a swing phase. I hope this video is useful for you in study or in clinical reasoning. Have a nice day. Stay healthy.